Well, what I want to talk about today is something I get questions about all the time, and that's how do I sleep at night when my back is bothering me? So the advice I want to show today basically has to do with what we call mechanical low back pain. And that is to say back pain that's being caused by the muscles, joints, or discs in the back and not by something more serious. If you have back pain only at night and it has a throbbing quality and it keeps you up, it may be something that you need to get checked out. So this is only mechanical back pain we're talking about, and I want to make sure that you're not ignoring symptoms you should be paying attention to. So the typical problem people will have is they'll lay down at night, they have trouble finding a comfortable position, or they find a comfortable position, get to sleep, and then their back wakes them up again. So this is a problem for a lot of people. So we're going to try and show you some tricks to try to see if this can help you out. But first of all, it's good to understand what the basic problem is. This is a model of the spine, and this is the natural position of the spine. And what happens is that has a curve in the low back, and just to orient you a little bit, this would be the spine, the stomach would be out here, head would be up here, no rib cage, and this would be your low back. So there's an inward curve there, and usually the spine itself is straight. The problem is when you go to sleep at night, if you lay on your back, you can see that nothing is supporting that inward curve, and that's uncomfortable. If you lay on your side, nothing is supporting your back from the side and it tends to sag, or your pelvis is twisted like this and it tends to put a twist on your back. So the problem is, how do we support the back at night so that you're comfortable and can sleep through the night? The advice most people have heard of is to put some pillows under your knees. And what that would do, and we'll show you later with a person, if you're putting pillows under someone's knees, it tilts the pelvis so it makes the back not quite as much arched, which helps a little bit. The other advice you get is to put a pillow between your knees. And what that does is with a pillow between the knees, it tilts the pelvis back so there's less twist on the low back, but it still doesn't support the low back pretty well. So what we're going to do is we're going to get somebody in here and set them up in a way to try and make them comfortable. So here we see the pillows under the knees, and there's still quite a bit of arch to the back, less than before. Another alternative some people use, go ahead and lift your legs up there, is to take a couple of sofa cushions, go ahead and lift your legs up. These are two sofa cushions put together, wrapped up with a sheet so they won't fall apart. And you can see by bringing the knees up higher, that makes the back flatter and puts it in a more comfortable position. If something like this doesn't feel comfortable, some people will roll up a flat towel and stick it under the back. Okay? So that supports it well. The problem with a position like this is often at night you move out of it. Is that pretty comfortable for you?
That's good.
So you're going to have to go ahead, if you want to try this, you have to find the right thickness. The thing with all of these techniques, if it's right, it's going to feel good. It's not something where it feels uncomfortable and you have to get used to it. No, no, no. It should feel right away, so you're the judge of how thick this needs to be, how high this might go. Let's look at that laying on the side again technique. So go ahead and roll on your side there. And again, this is a technique you may have heard about with the pillows between the knees like that, so that the pelvis isn't twisted. And again, there's not much support from the side. You could take a small towel, put it under your side like this, and now again, he could be supported in that position, but the whole problem is most people move around at night. Is that pretty comfortable for you?
Yeah.
Okay. So we have that. Now I'm going to show you a little bit more advanced technique using a towel roll. And I'll show you later how that towel roll is constructed. And what we've done, go ahead and stand up now. And what we've done is we've taken a sheet and rolled the towel up inside of it. So that it's such like that. And go ahead and turn it toward me. And then it goes around the waist like this so that the towel comes around to either side and it ties in front. And go ahead and turn around now. So you can see the advantage of this is there's towel roll here and there's towel roll behind. So go ahead and lay down there. And you can see that now when he's on his back, his arch is supported by the towel roll behind him. And go ahead and turn on your side. When he's on his side, it's supported from the side. So that keeps his back in that neutral position. Now you can see where his legs are. He still may want to go ahead with this. Does that feel pretty comfortable to you?
Yeah, it does.
Okay. And when he turns on his back, go ahead and turn on your back again. And lift those legs up. It may be more comfortable to have a little bit of pillow still. It all depends on what's individually comfortable for you. So what I'm trying to do is show you different options to try. I cannot tell you which one of these will work for you personally. But these have worked for hundreds and hundreds of people, one or the other of them. And again, people will ask me how thick this should be. This is what we call the Goldilocks roll. You have to roll it until it's just right. So you may have to try different towels, and don't roll it too tight or it'll feel too hard. You want to flat fold it, and again, I'll show you the technique for making one of these things. All right. Now we're going to go through a little bit more advanced techniques. All righty, and go ahead and turn toward that direction there.
Okay.
How else could we support? How else could we support, again, now that we're recognizing the problem, how else could we support that? Another way to do it that some people like, roll back a little bit. I'm going to take the corner of this pillow and stick it under his side right there. And then he's going to roll onto that pillow, and he can maybe even hold on to it. So now his whole side is being supported by the pillow. And he may or may not want a pillow under his leg like that, so that's pretty comfortable. Good?
It's nice.
Okay. The other option is, let me have you turn your back to the camera now. There we go. We could do the same thing from behind. Take the corner of this. It goes under his side. He rolls back onto it. And now, because he's rolling back, his pelvis has to be twisted with it. So we may want to take two pillows underneath there, like so. Maybe, is that pretty good, or do you need another?
Two feels okay.
Two feels good. So he's rolled back slightly on top of that. All of these are ways where you're going to try and support the back in that neutral position we talked about earlier. Okay. So this is a towel folded in half, and I'm going to take this and start with a flat fold. Don't try and roll it up real tight. Start with a flat fold like that. Bring it up. You don't want it too tight. You want it a kind of a loose roll. And that feels about right to me. Again, each individual is going to be different as far as how thick this needs to be. So this is a sheet folded in half, and then you want to fold that half diagonally. So you've got this. And then here's our rolled up towel. And it goes right at the inner part of the sheet there, and you just roll it up inside. And when you're done, there's your towel roll. It goes right around you like this. And you're good to go. It may be that it'll take a little time to adjust to this, so if you fall asleep, you're very comfortable, you wake up at 2 or 3 in the morning and feel stiff, maybe you can sleep the rest of the night, take it off, and give it a try in that direction. Again, these tips we've shown you have worked for hundreds and hundreds of people, and we hope they're helpful to you. We're very excited about putting this information out there, and we hope to be visiting a number of topics having to do with back pain in the future, so look for those. Thanks.